All right, this is my audience. There's 3, 4, and 5.
What are you waiting for? Waiting to breathe. All right. Why is it that Mackenzie can walk, but she's diagnosed with disabilities? Well, Mackenzie has, as you all know, Mackenzie has myelomengicell, which is also known as spina bifida. Spina bifida is caused during pregnancy, in the first stage of pregnancy. Here's an embryo. Kind of head here. The brain is up in here. Here is the spinal cord. When the brain and the spinal cord do not fuse right, it will cause spina bifida. Myelomengicell is when there is a sac-like form of fluid outside of the spinal cord with nerve endings from in the spinal cord exposed. Abnormalities that happen with spina bifida is paralysis between the waist, from the waist down. All or some disabilities with the bladder and kidneys, and hydrocephalus, which is fluid on the brain or inside the brain, which is the fluid from the spinal cord to the brain. There are several tests that can be done to see if your baby is diagnosed with spina bifida. One of the tests is done inside the mother's womb. A long needle can be injected into the mother's womb, into the embryo, and the sac-like inside that, and a spinal tap. It's called a spinal tap or a lumbar puncture, and cerebral fluid is taken out to be tested for spina bifida. Another test for spina bifida you can see during an ultrasound. The tech or the doctor can diagnose by seeing a pouch of fluid on the spinal cord. That is how Mackenzie was diagnosed with spina bifida. As you guys all know that Mackenzie wears pull-ups, but you guys don't know exactly why she wears pull-ups. And I will show you exactly how the kidneys are supposed to function for spina bifida children. When a spina bifida child has a problem with the bladder, it's called neurogenic bladder disability. You have the kidneys here. And the bladder down here. The lining of the bladder is the detrusor muscle, and the sphincter muscle is right in here. The sphincter muscle allows the bladder to empty. If these muscles aren't working together and having spasms right in here, it will cause pressure down on the sphincter, which causes leakage of the bladder, which Mackenzie has leakage of the bladder. Mackenzie has a high damage bladder, but she's still able to have some function with the bladder.
Mommy, can I have some pop?
Also, high high damaged bladder. Things that we can do to prevent more abnormalities with her bladder is routine restroom breaks, and plenty of fluids. If this is not done, it could cause infections of the urinary bladder, which is a UTI. Also, if the infections are untreated and the urine is unable to empty, it could cause kidney damage or severe kidney failure. And with kidney failure, the body is at shutdown. Which leads me to Mackenzie's physical abnormalities. Why is it that Mackenzie walks? Well, we have no reason for why Mackenzie walks. She is a miracle child, and that she was in many years of physical therapy, but there still is no reason why she is walking. So I have told you guys today, you guys all know that Mackenzie was diagnosed with spina bifida, but now you guys know a little bit more what the diagnosis is, how the kidneys work together, and the abnormalities and the functions that happen. If these are not kept up and taken care of, it could lead to many other abnormalities that could cause her not to have a high functioning life. And I believe that's